Good evening, everyone. Can you all hear me? Yeah. Okay. No, it's been a too long, hard day. So this is a final push. Okay. So I'm going to talk about vitamin D metabolism and bone health. Thanks for introduction, Will. To start with, I thought I'll just give you some quiz there. If you can just write down, there are about 4 or 5 questions which come through. We'll discuss the answer in the end. I'll just give you some time to go through the questions. There is a link between these 4 images there. Think about what that could be. Okay. Second one, which of the following are the risk factors for vitamin D deficiency? Could have more than one answers. You will get a copy of the lecture in a PDF format. Marnie will be sending it to you, so don't have to take videos. I'm sure they'll send you the copy if you wanted to, but feel free. Okay, so more than one answer is right for that. So northern latitude, about 37 degrees, winter and spring season, Asian and African people wearing concealed clothing, children with cerebral palsy, immobility, and excess use of sunblock cream. Okay, moving on. Vitamin D is present in the following food sources, except there's one of those doesn't have vitamin D. These are questions purely I wrote it up, so these are not exam questions. So don't feel that it's going to come. But I have written a lot of questions on this, so I'm just with my experience, I've just wrote a few as just an example. Okay, so one of them doesn't have vitamin D. Okay. Where exactly is vitamin D absorbed in your GI tract? Which part of the intestine? Okay, just write it down somewhere. I have the answers in the end of the lecture. Okay, so which of the following is true about vitamin D deficiency? The 25-hydroxylation occurs in the skin. Breast milk contains more vitamin D than formula milk. Calcidiol is biologically active form. It's more common in mothers with high vitamin D levels. Less than 10% comes from dietary sources. Okay, this is a case which I came across about 3 weeks ago. So the story is a 14-month-old boy born to a Kenyan parents was referred to my outpatient TB clinic. I do TB clinic as well. He came into contact with his dad, who had a smear-positive TB. He was treated by the GP with the iron supplements because he was iron deficient. His height and weight were on the 25th centile. His clinical examination was unremarkable, apart from the bow legs he had. And that's an X-ray of his wrist. And these are some blood investigations. You can just briefly go through that. And what's the diagnosis? Okay. Let's just move on. Okay, so vitamin D is an essential sort of nutrient which is very important. It influences many systems from head to foot. You'll be seeing in subsequent slides what are the sort of organs it affects, almost most organs. It's a very common problem. They say roughly 1/5 of the population in the world are vitamin D deficient. It's very easy to write the questions on as well, because as you know, it's a juicy one to write. Like I wrote this question within one evening, all those 5-6 questions. Okay, so where exactly you live does matter, particularly with regards to the sunshine. Okay, so if you're living further away from the equator, being in UK, you would know how much of sunshine you get right through the year, particularly in the winter months, November to February. You're not going to get any ultraviolet B rays at all. But the good thing about this is that even in the summer, if you have a short period of exposure to the sun, will give a good supply for a long period of time. Okay, so a lot of holidays, sunny holidays would be one of the best resources for vitamin D. Okay, and there are particular diseases that are very common in sort of up north, northern away from the equator, like asthma, allergy, sort of immune problems, rickets, and you have the sort of images on the right side. Problem with the depression, more common in sort of away from the equator. Osteoporosis, type 1 diabetes. Why is that? What is the common link factor? There are a lot of studies coming out. The common link factor, and one of that is vitamin D. Okay, because the reason why that is a rule of thumb. So you get vitamin D from the sunlight. You need to have a ultraviolet B rays for you to produce vitamin D. I'll explain to you how it's produced in the next slide. But you need to know, if your shadow is shorter than you are, then you get sufficient ultraviolet B rays to generate vitamin D. Okay, so it has to be, say, mid-afternoon. You get more ultraviolet B rays, thereby you can produce more vitamin D. But early morning or evening, when your shadow is longer than you are, then obviously it's going to be hard and you're not going to get much vitamin D. So very common problem, as I said, is 1/5 of the world population has got vitamin D problems. And there's a recent study in Midlands where there is a big multi-ethnic population, and they felt that it's very common, more common so in Afro-Caribbean. So if you have a dark skin, you tend to have more melanin, which is protective against ultraviolet rays, and thereby you need more sunshine for Afro-Caribbean and Asian people to generate vitamin D compared to Caucasian. Okay, and also using for cultural reasons, you may wear sort of clothing or excessive use of sunscreen will also prevent you getting vitamin D. Okay, in the summer, just 30 minutes of good sort of sunshine can generate 2,000 international units per day in adults, and 2 or 3 times a week, if you have just say half an hour exposure, that should be sufficient. If you have exposed to the sunlight during the summer months, you have a long-term sort of storage of vitamin D in your body. Okay, so this is one slide you want to take home, really. As you can see there, when you're exposed to the sunlight, that's the ultraviolet B rays, okay, when it's exposed to the skin, the dehydrocholesterol in your skin, okay, undergoes some changes to produce vitamin D, okay, and that's there. So 90% of your vitamin D comes from the sunlight, from the ultraviolet B rays, which interacts with the cholesterol to form the vitamin D, okay. 10% comes from your diet, which includes the fortified cereals, cod liver oil, salmon, okay. And the vitamin D which is produced, this is not an active one, so it needs to be converted it goes binding to a protein to the liver, and where 25 hydroxylase produces 25 hydroxy cholecalciferol, okay, and from there it goes to the kidneys to form 125 dihydroxy cholecalciferol. So in the liver, 25 hydroxy cholecalciferol, and then goes to the kidneys with the help of this enzyme, produces 125 dihydroxy cholecalciferol. And some of them just go to the different organs, as I said, from head to foot. They all have the receptors of vitamin D attached to them, okay, and as a result, some of the vitamin D gets converted in the other organs as well. As a result, it helps with the regulation of the cell growth in those organs, and thereby there is some sort of theories coming out that it helps in the prevention of cancers and stuff if you have adequate vitamin D levels, okay. And once the 125 dihydroxy cholecalciferol is formed from the kidneys, and that primary action is a calcium homeostasis, so calcium and phosphate homeostasis happens because of that, okay. I'll explain to the next slide how that happens. It also has an effect on the immune modulation as well as the blood pressure control in your system, okay. And it's a fat soluble vitamins. What are the other fat soluble vitamins? Very good, A, D, E, K, okay. Any questions on this slide? It's quite an important slide you need to know, okay. So 25 hydroxylase enzyme in the liver converts vitamin D into 25 hydroxylase, 25 hydroxy deoxycholecalciferol, and then in the kidneys, this enzyme 1-alpha hydroxylase produces the active form. Do you know when you do the vitamin D levels in the blood, when you ask for vitamin D levels in the blood, which form or what do you actually measure? Do you know? Any other answer? Be confident, that's the right answer. Okay, so 25-hydroxycholecalciferol is what you actually measure in the blood. Okay, but the active form, which actually does the action, is 125-dihydroxycholecalciferol. So that's the active form. That's actually what you're measuring in the blood. Okay. As I said, once the vitamin D is formed and gets modified in the liver, followed by the kidneys, the main action is to increase the calcium absorption from the gut. That's the primary action. Okay, and it stimulates the calcium resorption from the kidneys, and it also releases the kidneys from the bone. Both calcium and phosphate is released from the bone. Okay, and it helps in the bone mineralization as a result of that. Okay, so this is the primary action of vitamin D and its effect on the calcium and phosphate homeostasis. Okay, and this helps with the help of PTH as well, which has got a negative influence with the calcium. Okay, so the primary action is in the gut to absorb the calcium, and also from the bone, calcium and phosphate gets released, as well as it forms a bone mineralization with the help of vitamin D. Any questions on that? Moving on, there are different types of rickets. Rickets are nothing but softening of the bone because of the lack of bone mineralization. Okay, and if you read different textbooks, they all have sort of different types of vitamin D, different type of rickets, and these are the common things which has been documented. So one is commonly the vitamin D deficiency rickets, and that could be lack of sunshine, lack of sunlight, or lack of dietary intake. And then primary calcium deficient rickets, okay, or it could be the enzyme deficiency. The 25-hydroxylase in the liver could be deficient, or 1-alpha hydroxylase in the kidneys could be deficient, or it could be an end organ mutation problems because of the receptors being having undergone mutation. And the final one is a hypophosphatemic rickets, is primarily because of the low phosphate levels. The clinical features I'm sure you would come across. So as I said, rickets happen because of the softening of the bones, because the bones don't mineralize properly. As a result, these sort of changes you see in infancy, in the early part, you get softening of the skull bones and bossing of the forehead, and they start crawling, putting pressure on the wrist. They get a widening of the wrist. I don't know whether you saw that earlier X-ray images. There was cupping, spraying, which you would typically see because the child has been putting weight bearing on crawling. And in toddlers, you get the bow legs because of that. They put weight on that when they start walking. That's when you see. You do get a physiological bow legs, but it's quite a significant. The one child I saw 3 weeks ago in the TB clinic, you wouldn't miss it. It was quite a classical. He was walking like that because of the problems. We don't generally tend to see these days of rickety, rosary, and Harrison-Sulci because of the vitamin D deficiency. And the bone pain and fatigue is a common sort of presentation in your clinic. And this seems to be a fashion these days. I don't know if you guys attend the clinics. If you don't find any problems, you do vitamin D levels. They're invariably low, and you give vitamin D to supplement to make them happy. Okay. And there are 3 different stages of vitamin D deficiency. What exactly happens? The first stage, what happens when the vitamin D levels falls for various reasons? The first thing, as I said, the calcium absorption from the gut and from the bone is diminished. So you get the transient hypocalcemia because of that. When the calcium is low, that has got a negative feedback on the PTH. So there is excess PTH being produced by your parathormone. Okay, and that causes increased production of sort of absorption of calcium, trying to normalize the calcium. So in the first stage, there's low calcium, and the second one, the calcium is normalized, but that ends up in having low phosphate levels because it doesn't get by the action of the kidneys. And the third stage, where the persistent bone demineralization happens, as a result, you don't get a proper mineralization of the bone, so you get low calcium in the end. So these are the 3 stages how vitamin D causes rickets in babies or children. The various parameters you need to know what exactly happens in vitamin D deficiency. There are different cutoff levels people tend to use, but this seems to be the fairly common sort of levels of vitamin D which has been classified as deficient. So level below 25. The NICE guidelines or NICE guidance recommends 25 as a cutoff level for vitamin D. Okay, in some of the countries they use 30 or 32 as a cutoff, but in UK, NICE guidance says it's 25 nanomoles per liter is deficient. And they can have low or normal calcium depending upon what stage of deficiency they are. The early stage they'll have low calcium. The second, later on, it may get normalized. Because of the low calcium, you get a stimulation of parathormone. As a result, the PTH is raised. And that causes reduction of the resorption of phosphate in the kidneys, leading to low phosphate. Okay, so you may have a normal or low calcium, but the phosphate is invariably low. And obviously the high alkaline phosphate, like you saw the case earlier, which was 3,200 or something, and that indicates the bones working harder, okay, because of the high turnover. And that seems to be used as a marker for treatments. If you're giving vitamin D treatment, that's one thing we tend to monitor to see the response of the child to treatment. And if it doesn't come down quickly, you have to think about compliance issue. So if you're giving vitamin D to a child, because generally we tend to give it for 3 months or so, and if the alkaline phosphatase doesn't come down, you should think of compliance issues. Obviously the X-ray shows the widening, the cupping and splaying of the wrist. Any questions on that? Okay. The standard prevention doses are, as you know, this is what has been recommended by sort of nationally. Okay. For newborns, it's 4,000 international units. Like, you know, Abidec, Dalivit, they all have 4,000 international units of vitamin D. And treatment. When it comes to the treatment of vitamin D deficiency, the primary things you need to know is ergocalciferol, which is a plant product, okay, and cholecalciferol comes from the fish or a mammal product. And cholecalciferol is something which is commonly used as a drug to treat vitamin D deficiency, okay. And activated vitamin D like calcitriol and alpha calcidol should not be used in children because of the risk of hypercalcemia. It's generally tend to be used in adults under strict supervision. Okay, so remember, ergo is a plant product and cholecalciferol is a fish or mammal product, and cholecalciferol is something we use as a treatment drug. Okay, and here are the doses for the treatment. I don't think you need to remember the drug doses and stuff, but roughly remember this is in sort of thousands, whereas the maintenance is somewhere in sort of hundreds. And the duration of treatment is generally for 3 to 6 months, which says 8 weeks, but depending upon how the alkaline phosphatase resolves coming down, and then the normalization of the phosphate and stuff gives you a clue that your treatment is working. Yes, you need to keep an eye on it. There's no hard and fast rule. Like, for example, the child I had, we did it after 2 weeks after starting vitamin D, and then the levels were beginning to slow down. Then we repeat it after a month. What is the plan? And then do it after 2 months, and then see how it goes. Okay, but it's important once you complete the treatment, you have to give a maintenance dose as well. If the child is likely to be vitamin D deficient, they like to go back to the same thing. So you need to be aware that they need to maintain vitamin D levels. Okay. There are a few facts about vitamin D, like we talked about. The one we measure in the blood is 25-hydroxycholecalciferol. Excuse me. But the active form is 125-dihydroxycholecalciferol. The child bow legs and stuff, that will take up to 2 years. So you don't have to, it takes a lot of time for them to remodel. And I said you need to keep an eye on the alkaline phosphatase and PTH. They have to normalize. And calcium supplements may be required if the calcium is really low. If you're picking up in the early stage, then you have to give calcium supplements as well. As I said before, if alkaline phosphatase doesn't come down, you have to think about the compliance issues. Okay. As I said, vitamin D has been a sort of hot topic in the sort of last few years among the scientists, and they've mapped a lot of DNAs where the vitamin D receptors have been found on sort of more than 200 genes where they've isolated that it can have an effect on. And as a result, they're at risk of having vitamin D has been linked for various sort of problems like autoimmune conditions, type 1 diabetes, and various cancers and stuff. This is partly because all these sort of cells, they have vitamin D receptors in them, and as a result, if they have adequate vitamin D levels, then the risk of certain cancers like prostate and colon and stuff is reduced. They're clearly indicating that the vitamin D receptors is present in various organs from head to foot. It's quite important to know. Thereby, it can influence various things. For example, it regulates the immune function, particularly innate immune system. It helps in the regulation of cell proliferation and differentiation. Thereby, if it is deficient, then obviously it can go wrong, leading to cancer. And its effects in pregnancy, it helps in the right through the pregnancy as well as the child. Helps with the growth of the fetus within the womb. Okay. And there is a Cochrane review as well regarding the role of vitamin D supplementation in asthma management. It's not the sole treatment. You need to continue with the asthma treatment, but as a vitamin D supplementation along with that certainly reduces the acute exacerbation of asthma. It reduces from 6% to 3% of acute hospital admissions if they don't have a stable vitamin D levels. Okay, so you can see that it can affect multiple organs from head to foot, various diseases, but it doesn't necessarily help with regards to day-to-day asthma control. All it does, it helps in the reduction of acute exacerbation. And there's a theory it's possibly related to it prevents, because of the immune modulation, it prevents the child having frequent upper respiratory tract infections. Thereby, it prevents the asthma exacerbation secondary to a secondary viral infection. Coming back to those picture quizzes, did you get that right? The sealed blubber, fat is a sink for vitamin D. They have a lot of vitamin D in there. It's a fat-soluble vitamin. And I said 90% of the vitamin D comes from the sunlight. It's been shown to reduce the acute asthma exacerbations. Obviously, breast milk doesn't have much vitamin D. As a result, exclusively breastfed babies are recommended to have normal supplementation of vitamin D.
Do you need, like, you say exposure to the sunlight, is it just enough that you expose your face? Or do you need, like...
The more you expose, the better it is. Doesn't necessarily mean that you have to take sunbath every time the sun is out. Okay. But more you expose, the better it is. But so they say that even for just half an hour, 2 or 3 times a week during the summer months will help your vitamin D levels to stabilize to take you through the winter months. Okay, but the rule of thumb is the shadow is important, so it's a mid-morning or mid-afternoon sunlight is much better than the morning or in the evening. Okay, any questions on that? Okay, all those were risk factors for vitamin D, as you know. So further away from the equator you are, more at risk because you don't get much sunshine. Winter and spring seasons, you hardly see any sun out. Asian and African people, they have more melanin in the skin, which protects against ultraviolet rays, thereby they need more sunlight for them to produce vitamin D. Obviously, if you use lots and lots of sun cream as well, that prevents vitamin D absorption. And egg white was the answer for that question. Everything else has got vitamin D. It's quite difficult because when you say that 90% of the vitamin D is produced from sunlight, only 10% comes from the dietary. That's what you can control them, and this is the advice you give them for them to help with. And that's when the problems with the vegetarians come into play. You don't see much apart from fortified cereals and stuff. It's less chance of them having vitamin D, so they're at risk of having vitamin D deficiency. So when you're taking history and stuff, it's quite crucial to get the vitamin sort of history taking is important about vegetarian or non-vegetarian.
Do you ever get sort of parents sometimes then saying about sun exposure and how you're advised not to use sun cream?
Yeah, it's a bit of a balance really, and particularly as the Asian and African Caribbean population, it's more difficult. So we need to explain to them it's weighing the balance between exposure to there. How many of you get this right? Put your hand up. It's quite a few. Okay. Sorry? It was a good guess. Okay, so it's mainly in the small intestine. Hopefully you got that as well. Obviously it was fairly straightforward, classical case of vitamin D deficiency. So he's iron deficient as well, so it's possibly likely to be just dietary. And being an Afro-Caribbean, obviously from Kenya, he needs more sunshine to get his vitamin D. That's a classical X-ray findings, the cupping and spraying, the champagne glass appearance of the wrist.
Can you go one bit?
Sorry?
Can you go one bit?
Okay, in summary, vitamin D is vital for optimal health, mainly for the bone, but it has an effect, an influence on other parts of the body from head to foot. Insufficiency and deficiency are very common because of where we live. Active form requires in vivo activation. So as I said, the vitamin D which is normally produced is not an active form. It has to go hydroxylation in the liver followed by kidneys to get into an active form to have any effect. And it interacts with many organs in the human genome, and they found that more than 200 genes have got the vitamin D receptors. Thereby, they are able to say that vitamin D has an effect on those sort of organ damage like cancer and autoimmune diseases. This is just a quick world through of vitamin D and its pathophysiology. Any questions on that?
For newborn breastfeed babies, you have to do supplementation for
It's generally recommended. In some of the regions, I'm not sure, where do you normally work? Where do you work?
in Malta.
Okay, Malta. Like for example, in certain, not all parts of the UK, there are certain parts of the UK it's automatically given for all babies as they're born partly because the multi-ethnic population, if there's a high sort of immigrant populations there, they tend to give it as a routine for all the babies, but it's generally recommended.
Because we had a few talks as well about it, and they do recommend as well for part of some dogs and so on. Even in Malta, it's not enough, although we have a lot of sun.
Okay. So that clearly explains.
So
Yeah, general recommendation, yes, they do need routine. That's correct, yeah. Having said that, both my kids were breastfed and I didn't give vitamin D.
You know the question that you had with the X-ray?
Yeah.
So the ALP is high?
Yeah, alkaline phosphatase, yeah, 3000.
Is high.
Yeah.
I'm just working out, because why would it not be, I missed it, but hypophosphatemic?
Okay, in the hypophosphatemia, the PTH is not that raised usually, and the alkaline phosphatase is raised, but not as raised as this one.
Right, okay, sorry.
Yeah, and also the vitamin D levels will be normal,
Right,
but here vitamin D level is low,
okay,
so that's a clue there.
thanks.
Yeah.
What would be the biochemical changes in vitamin D resistant rickets?
Okay, vitamin D resistant rickets, good point. The thing is that the vitamin D levels will be normal. Yeah, it's an end organ damage receptor mutation. So even though there is a high level of vitamin D, it's not able to act on the final bit. So the vitamin D levels will be normal.
The other parameters be as high, the alkaline phosphatase.
Yeah, they will be raised.
They be raised as much as that?
That-
Or just
It's hard to quantify, but still, because of the low levels of the bone turnover and stuff, it will still be raised.
raised? Because the bone calcium.
That's
acting
correct.
on the PTH
That's correct.
Rather than the vitamin.
That's right, because this is not able to act on.